Welcome. My name is Anita Karcz. I'm the Chief Medical Officer of the Institute for Health Metrics. Today, I'm going to talk a little bit about the social determinants of health, really to give you a brief introduction to the concept. I introduced myself, but I'd like to introduce IHM. We are a not-for-profit organization, and what we do is help hospitals improve quality of care and reduce disparities by providing them with access to cleaned and augmented data from their EHR and also from other sources that they can use for advanced analytics to seek out patients with disparities both in their hospital population and in their communities to better serve them. Now, you've probably seen this in other forms over the years. This is not a secret. This has been going on for 40 years. The US, which is the red line, spends more on healthcare as a percentage of GDP compared to other high-income nations. And that gap has been widening over time. And what do we get for this? Well, we underperform in efficiency, access, equity, and outcomes. Here we are on those measurements compared to the other countries that we're being compared to. And why is this? Well, we have significant disparities in how people access care and how basic socioeconomic needs are met. We have a lack of universal health care coverage, for example, in the United States. And we have not really paid a lot of attention to the social determinants of health, which is what I'm going to talk about over the next few minutes. And the social determinants of health can really be expressed as simply as somebody having to ask themselves, do I use the money I have today to pay for food or to pay for the medication that my doctor prescribed for me? It's really pretty stark in that regard. So focusing on traditional healthcare will really only get us 10 to 20% of the way there. And this focus has not improved our life expectancy or our infant mortality rate, for example. And what do we need? Well, we need to improve access to food, to housing, education, employment as examples, and also to address underlying conditions that have widespread effects on health, such as obesity, alcohol, and tobacco use. And here's an example of the 5 broad contexts of social determinants of health, where you can think about them broadly. And I'll show you a matrix on the next slide that I think is very useful in thinking about social determinants of health and examples that fall under each of these categories. And you'll notice that there's a 6th column here, which is the healthcare system. The healthcare system kind of fits in here. These things cross each other. And the healthcare system is not really independent of those other 5 categories. And that's something I'm going to talk about in much more detail over the next few episodes of this series. So please come back and join me and learn more. Just a reminder of what we do. We are a mission-driven organization to help hospitals with their mission to improve healthcare access and reduce disparities. And I'd like to thank you for attending today. And if you have questions or comments, please contact me.